Bismillahirrahmanirrahim. I am Dr. Javed Iqbal Khokar, Professor of Forensic Medicine. As I started with the special toxicology, this is the second lecture of this series, and I'm discussing in this the sulfuric acid. And this is also called the oil of vitriol. Sulfuric acid is basically very easily available product. It is cheap and it can be easily purchased from the market because it is used in restoring the car batteries and also used in the leather industries. The concentrated sulfuric acid, which is mixed with water and it is commonly used in household drain openers, and it is available in various commercial preparations in almost every retail stores. So this is one of the chemicals which is involved in chemical burns. The corrosives and its reactive properties make sulfuric acid one of the most dangerous acid. And the damage caused by the sulfuric acid may range from simple irritation to a deep chemical burn and even necrosis. The concentrated sulfuric acid, which is almost 50 to 100%. Now, the sulfuric acid characteristics. In its pure form, it is heavy, it is odorless, it is colorless, and non fuming oily liquid. Unless it is mixed with water, then it fumes. And the commercial preparations, they appear as brown or black in color, and it is very fatal, and the fatal period can be 10 to 24 hours, and the dose is only 5 to 10 milliliters. Now the mode of action of the sulfuric acid, it is dangerous because it causes dehydration and it has great affinity for the water and removes water from the tissues and convert them to anhydrous material, and it literally pumps out water, all the water from the tissue, and causes necrosis. It appears as black charred tissues. The acid produces a gray-white necrotic membrane with swelling of the affected surface, which follows by brown or black discoloration. The maximum damage which is caused by dehydration and by heat production, which is an exothermic reaction by coming in contact with water, and this heat production causes necrosis, burning and charring. The sulfuric acid is commonly used chemical burns. These burns are painless, penetrating, and the acid devitalizes the tissues and predisposes them to infections. Repair is very slow, and there is always scar contractures, and even the death may result from shock, toxemia, if an extensive area is involved because of the superadded infection, and that will lead to septicemia. Then the signs and symptoms. The sulfuric acid uh, causes brown or black discoloration and staining of the tissues and clothes where it comes in contact. And whereas in nitric acid, these stains are yellow colored, but here they are brown or black colored stains, and there are always tickle marks. If it is ingested, there are tickle marks from the angle of the mouth and showing black color or brown color discoloration. The red color demarcation is not present, which is present in other cases, but in this case, the red color demarcation, which is actually the vital reaction between the living and the necrotic tissue, that is not so marked. And the sites which are likely to be affected in the by local contact, they are skin, face, mouth and throat, upper alimentary tract, and the respiratory tract, wherever they come in contact. So these are the most common sites where they come in contact. The early effects which are seen, they are basically pain, shock, vomiting, dyspnea due to respiratory irritation, and laryngeal edema. In the late effects, that it causes perforation of the stomach, pulmonary edema, bronchopneumonia. These are the complications. Regarding the delayed effects, it causes the strictures because of the scarring, the esophageal and pyloric strictures, laryngeal strictures, and pulmonary fibrosis. Regarding the treatment, there should be given injections like morphine for relief of pain, and to prevent thirst, the ice is given for the sucking and the licking, and to prevent fluid loss, the IV fluids are given. To prevent shock and esophageal stricture, steroid therapy is indicated, and to maintain airways open in case of acute edema of glottis, the tracheostomy is performed. The antidote for the sulfuric acid, it is milk of magnesia or mixture of soap and water, because these two combinations, they neutralizes the acidic pH to neutral, or uh, basically they act as antidote. When they come in contact with the skin, we should wash the corrosives, and the large amount of water should be used. Soap and dilute solution of sodium or potassium bicarbonate can be applied. Then the thick paste of magnesium oxide should be applied. And the raw surface, when there are injuries, they are covered with antibiotic ointment. When they contact into the eye, the concentrated sulfuric acid reacts with water of the tear, and the film of the cornea, the lot of heat is released, and it causes the thermal and the chemical burn to the eye. It causes very severe burn and may cause complete opacification of the cornea or perforation of the globe with the loss of the ocular fluid. The complications include glaucoma or the cataract formation, although the ocular damage caused by the concentrated sulfuric acid is very devastating. The diluted sulfuric acid cause much less damage because of the oxygen and the hydrogen molecules in the water that dilute the acid, particularly the striate and the acidic avidity for the same molecules in the eye. Consequently, the diluted sulfuric acid produces loss of exothermic reaction on contact with eye. It should be washed with large amount of water and irrigated with 1% solution of sodium bicarbonate. Eye drops containing steroids and antibiotics are helpful. Now, if it is ingested, milk of magnesia or the lime water or the soap water or this wood ash should be given. Demulcents, drinks like barley water and the beaten eggs should also be given. Now, we talk about the postmortem appearance. There are signs of corrosion, at the lips, mouth, surrounding skin, cheeks, and the chin if it is ingested. Pupils are dilated and carbonization will be seen, which is due to extraction of water from the tissue and the conversion of hemoglobin into hematine. And the entire GI tract, gastrointestinal tract, appears as black, dried, swollen, and charred mass. Tongue is black and corroded and shapeless mass. Teeth become chalky white. And no systemic effects because due to gastric perforation near the organs, it may partly be corroded. So they are mostly the local effects, not the systemic effects. Now, regarding the medical legal effects, the accidental intake because of its color due to keeping acid bottles with the juice labels that can cause accidental intake, and they can be mistaken as medical syrups or the whiskey. Vitriology. This is basically throwing of any corrosive on the face out of jealousy or rage, because commonly the sulfuric acid is used, and sulfuric acid is also named as oil of vitriol. Hence, after this name, it is said as vitriology. So, vitriology is not specifically throwing of the sulfuric acid but throwing of any corrosive. But commonly, when it is sulfuric acid used, that is vitriology. Thank you very much.